Dr. Tom Vellef, MD. You have a clinic that offers many services here, and part of that is dealing with patients on pain medication because you've discovered that their guts are damaged. And so you have new mandate from the DEA to help the patients get off the pain meds as much as possible.
Well, basically the mandate is to try to reduce the amount of medications that many of these people are taking. They need the medications to work, to function, but to give them other modalities and try to temper that, try to lower their medication needs, at the same time helping reduce their chronic pain problems.
So it's a legal requirement now upon doctors who prescribe pain meds to...
It's both a legal and a moral requirement. It's something that's just common sense.
So a lot of these patients get addicted to these drugs?
Many of these patients become addicted. All of them build up tolerance, which are two different things. Okay, but as a result of taking these medications, they develop multiple other problems and interactions with other medications, because particularly if they're elderly people that have been chronically in pain, they're on medications from various different places. They're also on other medications. They're on blood pressure pills. Maybe they're diabetic. They have all these interactions going on in their system, in their gut and in their liver, in their kidneys, and it becomes problematic. And so I love having other modalities that help reduce their pain, that allows me to lower their pain medications, which reduces their side effect profile.
So you're here with the ZoneRX, which is a postural restoration device.
Correct.
And some doctors use this automated, unattended, let patients climb on it and use it as much as they'd like. How do you use this instrument in your practice?
I use this instrument in people that have chronic back pain, lumbar, thoracic, hip pains, sciatic problems, okay? And I don't do it unattended, because when I put the patient on the machine, I'm in the room talking to them. I'm checking them. I'm asking them how they're feeling. I may adjust the...
So are you watching the lights to see if the lights come on?
Yeah, they keep all the lights on. They know what to do after the first time they're here. They're instructed what to do, and they know that they're...
Do you find they learn how to use it
They
pretty
learn
quick?
how to use it in the first time they do it, okay? And the first few times, they may not like it, but I've convinced them...
Because they're using muscles they haven't used together in years.
Okay? And so I tell them all, the first time you're on it, you're not going to be on it any more than 2 minutes. And you're going to stop, because you're going to get sore, and you're going to have, complaints about pain and soreness. And I want you to know that you're going to come in a couple times a week, and this is going to build up. It's like you're exercising. You're doing isometric exercise with biofeedback.
The underutilized muscles.
Your brain is learning which muscles need to be used to correct your posture, which is when you have the green lights on, your posture is corrected. And your brain is going to memorize that whole pattern of muscles and what strength they're being used. Your fingers are not being used at all, but your abs and your paraspinal muscles
pelvic
are.
muscles.
Okay? And so your brain memorizes that whole pattern of which nerve endings are firing, which muscles and in what intensity.
To get you out of the old ruts.
And as your brain memorizes that, it keeps your posture corrected. And by alleviating that pressure of the stenosis of the lower spine or pain from sciatic pressure, that alleviates their pain.
Now the machine itself is passive. The patients do all the work on it.
They do all the work.
Unlike a patient being adjusted while they're lying there passive, this is totally active patient activity.
Totally active. The machine doesn't do anything to the patient.
And it forces the patients to partner and use their own muscles.
To use their own muscles. Isometrically, they're exercising every time they're on it, and I build them up slowly. I don't let them do it unattended, because I'm in here talking to them, examining them, checking them, adjusting the machine, and that each time they come in, I go up in the time frame that they're on it, from 2 minutes to 3 minutes to 4, etc. And I build it up.
So you're able to, while they're doing that, talk to them about their case and their use of pain meds and
how they felt,
and how they've got to start using these underutilized muscles, because they have the favored muscles that are overutilized.
It's an educational process. I'm training them, and I'm having them understand and learn, because by the time they walk out of here, they're in my lobby talking to other patients, saying how great they feel, that their muscles are toning up, that now they don't have as much back pain, that they sit straighter. After they've completed the therapy, maybe a few months into it, these are people that come in to see me that say, Doc, I don't need as many, I got 40 pills left over. I don't need as many pills this month.
That's so wonderful.
That's what I
And
love
that's documentable. And that's
I have that documented in all their charts.
So
now, not every patient has had that result yet, but not every patient has completed the therapy.
So you use the Tesla-based technology to send patients home with that STEM equipment.
Yes.
And to treat so you have a home treatment in conjunction with the ZoneRX that's used in the office.
The only difficulty there is that I never know whether they're really doing the Tesla treatment.
But when you're here with them,
When I'm here with them, I know they're doing what I'm telling them to do, because I'm watching them.
Yeah. And so you've found that the patients, do the patients eventually like it and get results?
They love it. Let me tell you, I have patients that have completed the therapy. Their back is straight. Their pain is relieved. They don't need to keep coming. They come in every 2 weeks just to get on the machine because it makes them feel so much better.
And they're sleeping through the night.
They're sleeping better. So I can remove their meds that they take for sleep at night, which interacts with some of these other medications that they take.
Interesting.
And we're now doing, the pharmacogenetic testing to look at their meds and see how they metabolize their meds, so that in combination with the zone treatments, as their muscles tone and strength improves, I can reduce their medications, and I don't have so much cross-reactivity of their sleep meds, their pain meds, their muscle relaxers. All of these meds interact and can cause so many side effects. So my goal is to reduce the side effect profile in these people, because they're still going to have chronic pain. But if we can reduce their pain from a 8 or a 9 level where they really need surgery, and I can reduce their pain to a 2 or a 3, this is a person who could now function, go to work on far less medicine than they used to take, maybe none, certainly half, and they're functioning as well as they did, better than they did when their pain level was at 9 on high-dose medicines.
So initially, their muscles that have been underutilized
because
are so atrophied.
Not only that, they're guarding, because every time they move, they hurt, and so they don't use those muscles at all.
So they have to, on this machine, they have to use all those underutilized muscles, and it's the muscles in spasm in the low back that are being used to compensate for the weak glutes and hamstrings.
That's why in the beginning they have pain. The first times they use this machine, even just for 2 or 3 minutes, they'll come back in a few days and tell me, I hurt for 2 straight days.
Well, it's because they're using muscles they haven't used in years.
Exactly, and I teach them that, and then they see, and I say, you've got to continue doing it.
It's like when you were a kid in junior high and you ran around the track when you hadn't worked out.
I tell them, it's just like when you were a teenager and went to the gym to work out. You're going to be sore for a few days, but if you keep doing it...
So it's a good sore.
It's a good sore.
I use my muscles finally.
Right, and then after a month of doing it, you don't have. Then they come in and they want to do. They're up to 6 or 7 minutes. And they want to do 8 or 10 minutes. They say, I can do it longer. Your
patients are actively using muscles that have been atrophying and wasting. If you don't use it, you lose it, right?
I have 85-year-old patients who come in every 2 weeks to get on this machine because they feel so much better.
Would they be upset if you didn't have this machine?
I think they would.
Let's say it disappeared.
They would be totally upset.
Totally upset.
Totally upset.
Do you think that you could guide a patient through all of these exercises without the machine and make sure they're pulling with their heels and flattening their back?
No.
You'd have to put all your sensors in your hands. You'd have to do this manually. It'd probably take you an hour per patient.
Even if it took you an hour, they wouldn't remember it.
Yeah.
It's too many things for them to, they wouldn't do it.
So the machine automates a totally active patient, not a passive patient, using their own muscles to form the new muscle memory to pull themselves out of those ruts and old neurological patterns that are the key to their pain.
Yeah.
And it fires these underutilized muscles, corrects the imbalances. The machine doesn't do it. Their own muscle activity brings their body back to postural neutral. And what's bizarre is the machine is totally passive.
Passive.
All that happens is lights go on when they push against certain sensors. If they push against this and take the lordosis out of the low back, so
you can see the light coming on if you push that.
Yeah, as you push that, the light comes on.
Correct.
So we have a series of different lights here.
Correct.
Will come on. If you push on this knee sensor here, I'm pulling on that.
A different light will come on.
A different light comes on.
And they have to hold that light on.
Mm-hmm. They have to do that simultaneously with this backlight too.
And we tilt the table so that it takes the pressure off the spine. There's no gravity. There's no weight pulling down.
So it tilts down.
This table tilts backwards, so they're in a.
How many minutes do the patients spend on the machine?
They start out with 1 or 2 minutes.
Okay.
And then over time they build up to 8 to 10 minutes.
7 to 9, 10 minutes.
That's about where I stop them.
And they don't really need much more than that.
They don't need much more, but then they come in every
and then
couple
maintenance
of weeks.
Every couple of weeks.
Is a maintenance.
Just a few minutes.
Some patients that have done very well come in once a month for maintenance.
So it helps correct the pelvic tilt where the ilia are tilted forward and twisted to the side. It helps to work with them in the transverse plane as they're twisted and wrapped. Do patients get this? They
get this because after they've done it several times,
they realize I'm twisted.
They come back and tell me I feel different. When they're sitting in the chair, they say this feels awkward. And I said this is normal. What you've been feeling all these years is abnormal. Yeah. You just didn't know it.
Because you've not been using your body in the right way.
And after they've done it for a month or 6 weeks, then they say, wow, what a difference.
Yeah. So a doctor trying to find a way to comply with the new mandates from the DEA.
This is great
So
because
this is like having a doctor on staff, isn't it? Some doctors tell us that.
It sort of is. Even though, as I say, I don't do it unattended because I'm spending that time talking to them and getting history.
Patients love that. It's doctor time,
FaceTime.
time.
They do. And so I take the time to be in here with them. I don't let them do it unattended. Not that they would do it wrong. Once they know how to do it, they could do it unattended. I could have probably 3 of these going on all at the same time, but I don't. I'm just using one at a time now. I probably run about 100 patients through this program, and at least half of those patients have reduced medication needs now after completing the program.
What percentage of patient medication use would you say you've found on average for those 100 patients?
I would say the reduction in medications is about at least a third of what they used to take before this therapy.
So they're down to a third? So
no, they're a third less than what they used to take. If they used to take 180 pills when they got to this office, they're down to 120 pills now.
Okay.
So a substantial reduction.
Is that in line with the goals of what the DEA has asked?
Totally in line with the goals. They don't want anybody on chronic medicines. Okay, people need them to be able to function.
Have you had patients get totally off their pain meds?
I have had some patients completely stop their meds.
And have you had some that still need the meds? All of them?
Yeah, the majority of them still need some medicine, but far less than they used to need.
So the process with them is not done. They're on a steady path of
ongoing,
improving and working to reduce.
Greg, these are people who've been ill with pain for 10, 15 years, some of them 20 years. So this is an ongoing process. I tell them this is a one-year plan.
Are they pleased with their progress?
I tell them it's a one-year plan. Yeah. Okay? They're so pleased, they don't miss their appointments. They come in to get on this unit.
Yeah, wonderful. They need it because if they don't get it, if they're not actively using those muscle groups simultaneously.
After they've done it for a few weeks and they realize themselves, they come to the realization that they do feel better.
Yeah.
They don't want to miss getting on the machine.
Interesting. So
they realize it themselves.
Yeah, so you don't need to harangue them to come in.
I don't.
This is like a don't miss your appointment
they joke
program.
with me. They come in, they say, I'm here for the electric chair today. And they come in and get on the chair. Some of them set the chair up and want to start tilting it back before I get in the room.
Well, we have
which they can do.
Many clinics let their patients come in anytime they want and get on it because there's they don't have to be there with them.
Correct.
Because it's targeted exercise. It's actually not having any effect on the patients other than the patient's own muscle activity.
They're doing themselves. Yeah, so they're doing it themselves.
It requires a whole active patient. There's a whole new revolutionary way to think about getting people back to postural neutral.
The beauty of it is, though, after having done this for about 7 months now, maybe 8 months, going on 8 months in the office, we're seeing a significant improvement. We're seeing the change. We're seeing how this... And the patients are seeing it.
Do they tell their friends? Have you found that there's benefits or practice?
We had an inspector. These inspectors come because it's a pain clinic. They come at random. We had an inspector come to the office. Of course, we never know when they're coming. They don't call. They just show up. They sit in. They pick a corner.
They want to make
seat.
sure you're not a pill mill.
Here's what they do.
Right?
They sit in the corner of your lobby and don't tell anybody. They don't come to the window. They don't tell the girls who they are because the girls would think it's a patient trying to come in. Right? They go and sit in the corner. We had an inspector come in a couple of months ago and sat in the corner. He said, you had a patient, and he told me afterwards when he finished his 2-hour inspection of everything and all the charts, and he wanted to know, what are you doing? What is this chair thing? And I said, I laughed, and I said, why do you ask? And he says, because you had a patient that came out. He said, I was sitting there observing who's talking and what are they saying. And he said, you had a patient come out, and he sat on the couch here, adjacent to where I'm sitting, and he talked to some guy that was sitting there on the couch, telling him, he said, you got to try that chair. He says, I've been doing it for 2 months and I feel so much better. And he said the patient was telling another patient, so he says, I got to know, what is the machine you're talking about that you're using with these patients? So I brought him in this room and showed him. I asked him to get in the chair, but he wouldn't. But he wanted to know, what are you doing that these patients are talking about it, and they're convincing other patients of how good it is.
That's exciting.
The inspector was shocked. He said, I've never seen this before. I said, I don't think there's another one in Florida that I'm aware of.
Because patients are, in your program, not lying on a bed being adjusted as if their spine floats in a vacuum. With your program, they're using their own muscle activity to work the underutilized, less favored muscles and finally get them firing in conjunction with each other, in combination, separate muscle groups firing in combination. And so this is interesting because the feds are committed with these inspectors to try to help ramp down pill mills and people pushing pain meds without doing anything else. Because
Which is a logical thing to do.
It's good.
I agree with that concept.
Yeah.
There's no question that that's a logical thing to do. The thing is, when you have a 45-year-old guy who fell off a scaffold and he's had 3 surgeries, but he's got 3 children at home and a wife to feed, he's got to go to work. And if he doesn't have pain medicine, he can't work.
Yes, good
So
point.
we have these chronic patients that are legitimate people. They're real people. They're everyday people that have to work, and they can't. And they're not ready to become an invalid. Okay,
I know.
So we need to help these people, and by doing these other modalities like this chair or some of the other therapies,
The Tesla-based technology going home,
the lasers, anything else that we do for them as an additional modality to help lower their need for medications, they actually love it because now they don't have to bother taking it during the day when they're working. They take it in the morning before they go. They take it in the evening when they get home.
Was the machine hard for you to learn to implement? And
No, this machine is totally simple to learn.
Okay. So it was a pretty painless process for you to get started with this
very much so.
in your practice.
Yeah,
And
very simple to begin to use.
have you found it professionally gratifying to get these kind of results for your patients?
It's been awesome to get these results. I want to share it with other doctors and let them start seeing the benefits of it.
It seems to me that if there ever was a need with all the people addicted to pain meds, destroying their guts, etc., there's long-term negative consequences for being on these products.
1 out of every 5 patients seen today in a U.S. physician's office was there for a pain problem.
Wow.
Okay, so this is so widespread.
And probably most of them are out of postural neutral. They would probably mostly benefit from being brought back and being active.
From the literature that I've read, probably all of them were, not most of them.
We've discovered the same thing. But it's better that you say that than I do. Doc, would you recommend other doctors who are working with patients, since 1 out of 5 patient visits are because of pain of some type, would you recommend that they seriously consider adding a partner to their practice who never asks for a raise and works 24 hours a day in this machine?
This machine is great. I'd love to get a second one.
Yeah, ZoneRX. Well, we can make arrangements for that. We're like Doritos. We'll make more. Thank you, Doctor. Can I have your permission to use this video?
Yes, absolutely.
And no one's offered to pay you anything of value as an incentive to make these statements? These statements are true from your heart to your colleagues, to your peers.
These are sincere statements. This machine helps.
Thank you very much. Appreciate you very much.